Welcome to the webinar. DocCom. Are you using all features optimally? Find out what you're missing. Hi, I'm Barbara Lewis, the managing editor of DocCom. Christoph?
Hello, I'm also here. I'm Christoph Detweiler, and I'm the designer of DocCom and the producer of the videos who did it with the other editors over the last 10 and a bit more years.
So we're hosting this webinar today because we discovered that many of our subscribers are not using some of the great features of DocCom, most of which Christoph designed. The webinar is going to last about 30 minutes, and a recording and the PowerPoint will be available on the DocCom website shortly. If you have any questions, please type them into the chat box, which is located in the panel. And if we don't have a chance to get to your question during the webinar, we certainly will respond afterwards. You might see a slight lag time when you're viewing the webinar. So I don't want to spend too much time. You all know DocCom, you're all subscribers, but let me just talk very briefly because I want to hand this over to Christoph to explain the features to you that you may not be using. So we started in 2003. This is a joint venture between the AACH and Drexel University. We got a grant through the Arthur Vining Davis Foundation. And we began offering continuing medical education last year, which was very exciting for us. DocCom has over 75 institutions as subscribers, over 20,000 individual subscribers. We're located in 9 countries and have been translated into 3 languages. Although DocCom started with medical schools, we've really branched out, and our fastest growing segment right now is residency programs. And by the way, we're having a residency webinar in March. If you're interested, let me know and I'll send you an invitation to that. We've had a lot of research supporting the value of DocCom, and here are some of the links if you're interested. I, of course, don't need to tell you about the evidence-based importance of communication skills, that good communication skills improve medical outcomes, enhance physician-provider satisfaction, decrease malpractice claims, and improve patient satisfaction. And, of course, communication is becoming increasingly important with HCAHPS, which are hospital surveys mandated by the government for patient satisfaction. And if a hospital receives any money from Medicare funds, then they need to participate in this program. And coming soon are clinician patient satisfaction surveys as well, and the private practice of physicians. So you know that our module authors are leading faculty. We have 42 modules, over 400 videos. We have annotated interactive videos in the modules, in some of the modules, lots of literature references and checklists. The faculty resources that we're going to delve into today include assignments, assessment questions, a grading matrix, syllabi, and curriculum guides. We've had a ton of testimonials from people who just raving fans, and if any of you feel the same way, we'd love to get a testimonial from you as well. So a brief tour here. You know that we have 4 basic modules, and we move to essential elements, advanced elements, and communicating in specific situations, and finally communicating with colleagues comprises the 42 modules of DocCom. So now I'm going to turn it over to Christoph so that he has plenty of time to delve into the wonderful features that DocCom has.
Thank you, Barbara. Yep, thank you, Barbara. So welcome also to our webinar. So DocCom, when we started to look at it, was done after this Kalamazoo report and the Institute of Medicine report defined what exactly are the healthcare communication skills. And so we modeled it to be a comprehensive collection of resources that really address all of healthcare communication skills. Then with an emphasis for physicians. Now we opened it up and it also includes other healthcare professionals. And we did it, we thought how to do that. It's about communication skills. So we decided that we start to open with a rationale, 40 seconds, that should be really interesting and catch you and allow you to find the energy to spend 1 hour or even more with the module. And then we have these patient and clinician views where the patient first says, like asked, waiting to see the doctor, what is going through your mind? And then the doctor is asked in the doctor's view, what is going through your mind, with the idea that we understand where there is a mismatch of expectation that requires good communication skills to resolve this mismatch of expectations. Then each module has also then the content, which is individual per module, and interspersed videos. Now, when we look at the patient's view, I recall when we recorded this one, but another one that is more at my mind is from module 33 on breaking bad news, where the patient says, I'm here to see my physician because I had to take a biopsy and I wish it is not cancer. And then we switch to the doctor's view. And in the case of the other module, which is just more clearly to make the point, Tim Quill, the physician who has to break the bad news, says, when I took the biopsy, I kind of told the patient not to worry too much. It almost certainly won't be cancer. Now I wish I would have told the patient that it might be cancer. Now I have to give the bad news. Then we always have questions for reflection. These are unique per module, depending on the content that is covered. Of course, the key principles or key concepts are being defined. And then the next point are the learning goals, which are also being named for each module. So this concludes the part where all the 42 modules, except the first 4, are identical in their layout. And from then on, each module develops depending on the need addressed by the module. So it's different how it continues from there on. Of course, in all the modules, we include literature references. This is an example that was we will now reduce the literature references. We find that we reduce it to 15 of the most important literature references, but some like smoking cessation or behavioral change therapy, of course, require more references. And they're all in the module, and you can check them out and look them up. Yeah, this is an example. What's also important at the end of every module, before the appendixes and the assessment questions and the CIME statement, we can see the behavior change checklist or the effective behavior checklist. This, in short, tells what in the module was conveyed as being effective communication skills to address this need that the module is addressing. Now, as Barbara pointed out, we have really videos embedded throughout. And this is really at the core of DocCom, these videos. Of course, I mean, communication skills, you can explain them, but so you can also show them. And Dave Duffy or other real master physicians showing on our standardized patients has proven to be a very good way how to convey how to do things at its best. What we do is different than most are doing. We do not script our interactions that we videotape. We have the real physician who acts as if he were acting on a patient, and we use our experienced standardized patients. And we have one of the oldest and biggest standardized patients programs in the region, and so it flows. So we don't put any words in the mouths of these specialists. What you hear in our videos is how the specialists are talking, and you can really witness how these master physicians interact with patients. I'm a physician, you're physicians, most of you are physicians, and it still is interesting to me. I can look again and again at these videos and learn every time something new.
And Christoph, in surveys that we've done with faculty, the students, the residents, across the board, everyone likes the videos and really appreciates them,
I'm
which is
very glad
wonderful.
that you mentioned that. So this is what I see as my contribution as well, because I'm the director of each and every of these videos, and this is something that I really do with my heart blood. I really believe that we contribute something to the culture of medicine by role modeling best behavior and making it available so you can witness it and make it part of your practice. Thanks, Barbara. So the Annotate videos, this is one of my inventions even. So in the year 2000, I received the European Academic Software Award for this as best educational tool, and that brought me then to the United States, first to Dartmouth, then to Drexel. So what you see while the video is going on, that the point where it is in the time is highlighted, and sometimes there is a special icon on the left side showing like a video projector, and when you click, the main video stays still, and a smaller video where the physician or the patient is talking about pearls of wisdom or differential diagnostic reasoning or whatever is on his or her mind. And so that allows me to add a meta level of expert knowledge to the videos. Usually a video is very linear medium, but this breaks it up. Usually what you've done with a video is you show something and you talk about, and you show something and you talk about, and I put the talk about in a special layer that is accessible on demand. So the novice can watch the whole annotated video and look at each and every of these annotations, whereas the experienced user, only when there is something that makes him or her curious, asks for the annotation to display the video comment or not. It's an interesting format that many people really seem to like a lot.
Yes, we've getting terrific feedback on this as well, and the next slide especially too. But before I get to that, I know that I don't think every module has an annotated video. Is that right, Christoph?
Yeah, that is right. We did most modules with annotated videos. In the beginning, you know, when we started DocCom to put it together in 2004, December, we did the first video on DocCom, and I started programming it. And then later, 5 years later, now we have an editor, and it makes it very easy to still reuse old videos that are not annotated and make them annotated. We still, when we do we edit, so the editors go through a third of all the DocCom modules every year. So every 3 years, all of the DocCom modules are being revised, and we also revise the annotated videos and make them stronger and better. That's part of the editing process. And now we have an editor, so even the editors can edit the annotations. What you're looking at is something new, very new even, and it's only available in DocCom Module 6. So in Module 6 you find after watch behavior, where the encounter is role modeled in an annotated video, you find the test understanding. This is a new model that I just submitted a proposal to the Stemler NBME grant to use at that, to look at that. And it is that you look at the video, and in this you can have a task. The task is identify situations where the physician does not provide an empathic comment, even there is a good opportunity to providing one. And while you watch the video, you click the button that you see there, missed opportunity for empathic comment, and it puts one of these needles that you see underneath into the timeline. And here, before you do the submit button, now we look at the situation after you submitted it, and then the submitting it reveals if you were doing this correctly or not. So you get an immediate visual feedback if you realize to identify situations where an empathic comment would be a good thing to do. I find this, as a professor who teaches communication skills to students, this is my single most important step, I think, in the teaching to get my students to realize when are the opportunities for empathic comments. When they get that, they become enabled to provide empathic comment. When they don't see the opportunity, this is always the first step. So I created this as an interactive tool to help them develop this skill.
Yeah, this is great, Christoph. I love this.
And now we are looking at something that is also unique in one module. Let me tell about that. This is in module 30, which is about the assessment of patients with substance use disorders. And there we wanted also to humanize. Of course, most of you are aware, if not all are aware, that one of the big problems with physicians, they seem often to be frustrated to treat patients who have substance use disorders. And we try to conquer that by giving a face to the substance use using patients who have recovered. And so these are 5 real patients, of which Cliff, when you look at it, and you can because you have subscriptions to DocCom, is a real family man. He had problems with alcohol and prescription drugs. So check him out. And all of these 5 patients do answer 22 questions. So they tell you about what made them able to quit, how did they quit, how was life after stopping to abuse drugs, and so on. And so you really get into the perspective of substance users, because this is not what they want to end up like, you know. And we have to convey, when we teach interacting with patients who have substance use issues, to look at it as a chronic disease and not give up on these patients. And I think by humanizing them, by allowing our students to take on their perspective, that can be a big help. We also did a research on that partly. This module, module 30, is also available as a standalone module because it was sponsored by the National Institute on Drug Abuse, NIDA, for which we have become a National Center of Excellence for Physician Information. So this is available forever and without copyright. So you can certainly use that, even parts out of it, in your teaching. And we got money to research its efficacy, and there we specifically looked if this helped to enhance the physician, or we looked at students and at residents' empathy, and we found that working with these with this module enhanced the residents' empathy towards substance-using patients, not the students. And we think that the reason why it did not enhance the students' empathy, because the students did not yet know what they didn't know, whereas the residents were appreciative of having a tool in their hands that helped them to do a better job. Now, one part of DocCom, of course, are the modules, which is the content and the videos and everything, but we also created a special learning management system for DocCom, and that allows to group together learning groups. It's very easy, and DocCom has even a grassroots approach and allows an admin approach, so both is possible. Everyone, you just go to profile my groups, you can create your group. Just do it. Create the group, give it a name, and then you can invite whoever you want into this group. And when you do that with your students, you will be able to see your students' results, what they did in the assessment questions, and you will be able to read their short answer question answers. And you can hover some of your students to become a co-facilitator in the group, but it's really grassroots. You don't need any administration to do that. You go in, you create a group, you say, join me there, and as soon as this happened and you have a group together, automatically who created the group, it's a group administrator, and you can then send assignments to the students who signed up into this group, and you can compose group emails, you can create assignments, and an assignment on the learner level shows on top of the table of content in a red box, and they just have to click in it, they read there, the assignment text and know what they have to do, click in it, and then they are in the module where they are supposed to do. You, as the admin of the group, you are provided with a blue box on top of the table of content, and when you click in it, you see what the students who received your assignment have been doing with the assignment. So here, this is a true one from last week that I used, but it was 2 days before the assignment was due, so only 3 of my students did already answer the discussion questions. The rest was waiting until the last evening, as always, of course. And we do mainly ask to provide us with a short question answers. We sometimes use multiple choice, but not so often. We are more interested in reading their, in getting an idea how they think, and we want them to reflect on what they look at. And then when you click on any of these names, you'll see the response. So here, this is a true example, and I can then score it of one of my students. This is about the module on diversity, where this is a student who answered. I think it can be potentially more difficult for a patient to trust a doctor who is from a different cultural. And so this is a kind of depth. It's really completely random. I had only 3 answers, and I choose one of these to show you at what depths our students answer these short answer questions. And then I score it and can also provide feedback. This is an example of such an assessment question as the students see them when they go there to answer them after the module. This is an example for an MCQ question. Here we have 10 MCQ questions, and MCQ questions certainly are a great way to get an overview over the knowledge of your students. I will show you that it really allows us to give an overview even if there are many, many students in a university. Okay, before we do that, we also have a way to show when you look at the grading, you check how the modules were answered, and you get also an idea where your students are doing better and not as good, but this is always related to the MCQs only. So you don't see here the scoring of the short answer questions. And also here you can always single out students and look at how they answered. And of course, we had this one already. This one in this slideshow, we had a little bit more on how this interaction with the short answer question works.
So this is a section that I absolutely love, because when I was teaching at UCLA Business School, I had an Excel spreadsheet that was tremendously large with all of my students, and here are the students in this case. They've been blocked out, and all the grades, and it just was completely unwieldy. But here's what DocCom does. So each of the modules are listed across the top in this matrix, which can be exported to Excel. So you're able to see here which modules have been done by which students. The students are over here. And you can pick out maybe a module that has been getting some low scores that might need to be reinforced. So the colors are color-coded by the score, with the dark green at 100 going down through lighter green, through yellow, and finally through orange, and then red, which is the lowest score. So this is a wonderful way to look at 2 things. One is how everybody's doing on specific modules and whether or not they're understanding them, and also taking a look at particular students and seeing maybe the student needs some extra help because the scores are a little low here. And here's a student who had only taken 2 modules, done 2 modules, and both of them are very low scoring. So this student may need some help. Now when you hover over a particular cell here, it describes the module and when it was completed. Is there anything else included here, Christoph, that I've missed?
Nope, that's it.
Okay, I love
No,
this part.
yeah,
Yeah.
thanks. I also like the color coding. It allows to really glance at a lot of data and immediately single out those who need special attention. That's the idea. This example is a real one. These are real data from St. George's University, and they just assign the first 12 modules. Every student has to do them, and they have to have at least 70 points, 70%, and if not, they have to redo the module and the assessment. But we have, I think this is a way to make sure that they really look into the module and do some thinking. Otherwise, they can't do the MCQs.
So this makes it really easy for the faculty, which I love. Of course, we have a lot of resources. There's a facilitator guide for the doctoring curriculum and a syllabus with about, I'd say 100 pages that is blow by blow. The first 5 minutes we'll do this. The second 10 minutes we'll talk. Here's the question that we're going to discuss. So there's lots of information available for faculty members in actually conducting the classes.
So the physician and patient course syllabus is the one we're using here at Drexel, and I would say it's Dennis Novak's life work almost. So we have 22 afternoons in the physician and patient course, and the complete syllabus is here. This is complete blended learning. We use DocCom as a resource for the students to get prepared. We often assign a DocCom module, then we meet in the hospital, we talk about the DocCom module, what they found, we read their short answers and use that as a discussion input, and then we go see patients and we go back. And so this is really the flipped classroom blended learning idea that we can use with DocCom. So we don't use the time when we meet with our students to convey knowledge, but to really in discussion deepen it and deepen understanding.
If you haven't checked out these resources, please do, because I think that you'll find them really beneficial and very helpful. So we're coming up on the hour, and I see that we don't have any questions. If you do have a question and you want to type it in, I will ask Christoph, or I could answer it. If you'd like more information, or if you have any questions, you can contact me, and here's my contact information. But Christoph and I want to thank you for attending the webinar, and that a recording and the PowerPoint will be on our website shortly if you'd like to review it or perhaps pass it along to other faculty in your institution. And thank you very much.
Thank you. It was a pleasure.